Your morning erections have disappeared. Not gradually, they just stopped. And now when you do get aroused, achieving full hardness takes longer, feels incomplete, or doesn't happen at all. You've probably blamed testosterone, age, or stress. But here's what's actually happening. Your penile tissue is experiencing structural changes at the cellular level. Without regular blood flow from erections, including those nighttime erections you don't even remember having, the smooth muscle tissue begins replacing itself with collagen. Think of it as scar tissue slowly filling in where functional tissue used to be. This isn't about libido or desire. This is measurable physical deterioration. And it starts happening faster than you think. But before you panic, there's something you can do right now that begins reversing this process within 48 hours. The single fastest way to trigger blood flow to penile tissue. Deliberate arousal, even without a partner. I don't mean casually. I mean intentional, 10 to 15 minutes, allowing yourself to reach full arousal and completion. This floods the tissue with oxygenated blood, temporarily restoring elasticity. Some men notice firmer morning erections within 2 days of resuming this practice consistently. I'm Dr. Mei Anderson. I've been a urologist specializing in men's sexual health for over 25 years, and I've worked with thousands of men navigating these exact changes. What I'm sharing with you isn't theory, it's what I've seen work in clinical practice when men implement it correctly. But here's what that one action alone won't fix. The underlying cascade that caused the tissue changes in the first place. Because when erections stop, whether from months of being single, health complications, medication side effects, or partner issues, your body interprets this as a signal. It thinks, we're not using this system anymore, so let's conserve resources. Your testosterone production adjusts. Your pelvic floor muscles weaken from lack of contraction. Your brain's arousal pathways start deprioritizing sexual stimuli. So while solo activity helps maintain tissue health, you need to understand the complete mechanism to prevent permanent structural loss. Your erectile tissue contains thousands of tiny expandable chambers called corporal bodies. Picture them like miniature balloons. When you get aroused, blood rushes in. These chambers inflate, and that's what creates rigidity. But here's what most men don't know. Those chambers need regular inflation to stay elastic. When you go 3 to 6 months without erections, and I mean all erections, including the 3 to 5 involuntary ones you're supposed to get during deep sleep, those chambers start changing composition. The smooth muscle cells that line them begin dying off and getting replaced with collagen fibers. Collagen is rigid. It doesn't expand. One study tracking men after prostate surgery found that men who went just 6 months without any erectile activity showed a measurable decrease in penile length, averaging 1 to 2 centimeters, because the tissue physically contracted and lost elasticity. This is why you might notice, when you finally do get an erection after a long dry spell, it doesn't feel as firm. It might be 70% of what you remember, or you achieve hardness but can't maintain it. Or it takes significantly longer stimulation to reach full rigidity than it used to. That's not a performance failure. That's structural reality. Your tissue has literally lost flexibility. And listen, before we go deeper into the solution, I need you to do something right now. Hit that like button. Here's why this matters. When you like this in the first 2 minutes, YouTube's algorithm recognizes this information as valuable and pushes it to thousands of other men who are typing, "Why can't I get hard anymore?" into the search bar at 2 a.m., terrified and ashamed. You liking this right now could be the reason another man gets the answer that changes everything for him. Takes 1 second. Do it now. Now the second mechanism, your pelvic floor muscles. Every time you orgasm, a specific set of muscles contracts rhythmically, usually 5 to 8 contractions over about 10 seconds. Those contractions do 2 things. They strengthen the muscles themselves, and they actively push blood into the erectile chambers. When you stop having orgasms, whether from sex or solo activity, these muscles gradually weaken. Think of it like this. If you stopped using your leg muscles for 6 months, you wouldn't expect to run a sprint without rebuilding strength first. The same principle applies here. These muscles atrophy from disuse. This is why some men notice they start having slight urinary leakage when they cough or sneeze. The same muscles that control ejaculation also control urinary continence. They're weakening from disuse. Third mechanism, the testosterone feedback loop. Your brain produces luteinizing hormone, which signals your testicles to produce testosterone. Regular sexual activity, arousal, erection, orgasm, keeps this entire hormonal axis engaged and responsive. Extended sexual inactivity correlates with gradual testosterone decline, which then further decreases libido, creating a self-reinforcing cycle. This is why men describe feeling, "I just don't think about sex anymore. I don't even miss it." It's not that desire disappeared on its own. The biological feedback system shut down because the body wasn't receiving signals that sexual function was still needed. Now you might be thinking, "Okay, I understand what's happening. I'll just start being sexually active again, and everything will bounce back." And that's exactly what most men try. But there's a reason it doesn't work the way you expect. Maybe you've tried already. You attempted sex with a new partner, or after a long break with your spouse, and your body didn't cooperate. You couldn't achieve full hardness, or you got hard briefly and lost it, or worse, you felt anxious the entire time, which made everything worse. So you figured, maybe I just need to relax, or maybe I need Viagra, or maybe this is just permanent now. Here's what's actually happening in that moment. Your body is dealing with 3 separate issues simultaneously, but you're only trying to fix one. Issue 1. The structural tissue changes we just discussed. You can't reverse 6 months of collagen buildup in a single sexual encounter. The tissue needs weeks of progressive, regular blood flow to regain elasticity. Trying to have penetrative sex immediately is like trying to sprint after 6 months of not walking. You're asking tissue that's been dormant to perform at full capacity instantly. The tissue physically cannot respond the way you remember, because it hasn't been reconditioned yet. Issue 2, performance anxiety. The moment you notice you're not as hard as you used to be, your sympathetic nervous system activates. That's your fight or flight response. Blood flow actually redirects away from your pelvis and into your major muscle groups. You're physiologically fighting against your own arousal. One man described it as, "I'm thinking about whether I'm hard enough, which guarantees I won't be." This creates a vicious cycle. You attempt sex, you're not fully hard, you get anxious, which makes you less hard, which increases anxiety. Each failed attempt reinforces the pattern. Issue 3. The timing of when most men attempt resuming sexual activity. You wait until you have a partner or opportunity, which might mean you've gone months without any erectile function. Not even morning erections. Then you're expecting your body to suddenly perform under pressure, in a situation that matters emotionally and relationally. You're essentially asking your body to execute complex performance at the exact moment when stakes are highest and preparation is lowest. That's why the standard advice, "Just take a pill and try again," works for some men but fails for others. Medications like Viagra increase blood flow, but they can't reverse structural tissue loss. They can't eliminate performance anxiety, and they don't address the underlying hormonal or muscular conditioning your body needs. I've talked with men who said, "I took the pill, it worked okay the first time, but then the effects seemed to wear off," or "It helped me get hard but I still couldn't finish," or "My partner felt like I needed medication to be attracted to them, which created a whole new problem." The medication becomes a band-aid over a structural issue. It might help in the moment, but it's not rebuilding the foundation. Another common mistake. Men try to force arousal when they're not actually feeling desire. They think, "I should be in the mood, so I'll just go through the motions." But arousal without genuine psychological engagement doesn't trigger the full hormonal and neurological response your body needs. You might achieve a partial erection, but you're not activating the complete system. That's like trying to start a car with a weak battery. It might turn over, but it won't run properly. The approach that actually works isn't try harder or take more medication. It's progressive reconditioning. Just like you wouldn't go from 6 months of no exercise to running a marathon, you can't go from 6 months of no erections to full sexual performance in one attempt. Your body needs a structured rebuilding phase. And this is where most men get it wrong. They think, I'll wait until I have a partner or until the moment is right. But by that time, the tissue changes have progressed, the anxiety has built up, and you're attempting the most difficult scenario, partner sex, as your first attempt. You're setting yourself up for failure because you've skipped the foundational reconditioning. The men who successfully restore full function, they start with solo reconditioning. They rebuild the tissue elasticity, the muscular strength, the hormonal responsiveness, and the psychological confidence privately, without performance pressure. Then when they're with a partner, their body actually cooperates. They're not guessing or hoping. They know their body can perform because they've systematically rebuilt the capacity. For men who understand the concept but struggle with knowing where to start or how to sequence things correctly, I organized the full process step by step in my ebook, The Complete Sexual Health Blueprint for Men Over 50. It's meant to remove the guesswork and provide clarity beyond what a single conversation can cover. Step 1. Establish baseline erectile function through scheduled solo activity. Notice I said scheduled, not when you feel like it. 3 times per week, same days, same approximate time. This isn't about pleasure or libido. This is tissue maintenance. You're triggering blood flow deliberately, allowing full arousal, maintaining it for 10 to 15 minutes, and bringing yourself to completion. The key is consistency and duration. You're not rushing to finish. You're maintaining arousal for an extended period to maximize blood flow exposure to the tissue. That 10 to 15 minutes of sustained engorgement is what triggers the cellular response. It signals to your body, we're using this system. Keep it functional. Why this works? Within 48 to 72 hours, you're increasing nocturnal erectile frequency. Your brain relearns to send those arousal signals during REM sleep. Within 2 weeks, most men report morning erections returning. One man described it as, "It was like my body remembered what it was supposed to be doing." Those spontaneous morning erections are your proof that the reconditioning is working. Your body is autonomously triggering erectile function again. But step 1 alone will only get you about 60% restoration. Here's what it won't fix: the muscular weakness. Blood flow addresses tissue health, but not muscular tone. Quick pause, and this is important. If you haven't subscribed to Vital Health Seniors yet, do it right now. Here's what you need to understand. What I'm giving you right now is the foundation, but there are 3 specific variables that determine whether you see moderate improvement or complete restoration. Those variables, and how to optimize them, are in the follow-up content coming in the next 2 weeks. If you don't subscribe with notifications on, you'll miss them. And here's what happens when men miss those pieces. They do the basics, see some improvement, but plateau at 70 to 80% function and think, I guess this is as good as it gets. Don't let that be you. Hit subscribe now. Channel name is Vital Health Seniors. Turn on notifications. Step 2. Active pelvic floor reconditioning. These are not passive Kegel exercises. You're doing resistance training for muscles that have atrophied. Here's the protocol. Identify the muscles you use to stop urination midstream. Contract them fully for 5 seconds, release for 5 seconds. 3 sets of 15 repetitions twice daily. But here's the key most men miss. You perform these during arousal, not randomly throughout the day. Why? Because when you contract pelvic floor muscles during arousal, you're essentially forcing blood into the erectile chambers against the natural drainage. This creates stronger, more sustainable erections. It's like doing resistance training while the muscle is already engaged. You're amplifying the effect. The muscle contracts against pressure, which builds strength faster than contracting in a relaxed state. Within 3 weeks, men report, I can maintain hardness longer. It doesn't fade halfway through like it used to. That's the pelvic floor muscles working properly again. They're actively sustaining the erection instead of allowing passive drainage. And here's an additional benefit most men don't expect: improved ejaculatory control. When these muscles are strong and responsive, you have more voluntary control over when you climax. Men who've dealt with premature ejaculation after a long break often find that this muscular reconditioning solves that issue naturally. Step 2 gets you to about 75 to 80% restoration. but you're still dealing with the hormonal and psychological components. Step 3. Testosterone optimization through timed physical activity. This doesn't mean hormone replacement, not yet. Your body has natural testosterone production capacity that's being underutilized. Heavy resistance training, legs back, compound movements, triggers acute testosterone spikes. The timing matters. Train in the morning 3 to 4 times per week. Your body's natural testosterone rhythm peaks in the morning. You're amplifying what's already there. Focus on compound movements that recruit large muscle groups. Squats, deadlifts, rows, presses. These movements trigger the largest hormonal response. You're not trying to become a bodybuilder. You're using exercise as a hormonal stimulus. But here's the multiplier. Perform your solo sexual activity 4 to 6 hours after strength training. Why? Because you're catching the testosterone elevation window, and you're conditioning your brain to associate that hormonal state with sexual arousal. You're literally retraining the arousal pathway. Your brain learns. When testosterone is elevated, sexual function happens. This reinforces the connection between hormonal state and sexual response. Within 4 to 6 weeks, men describe, "My drive came back. I'm actually thinking about sex spontaneously again, not forcing myself." That spontaneous desire is the clearest sign that the hormonal axis has re-engaged. You're not manufacturing arousal through willpower. Your body is naturally generating it. Step 3 brings you to about 85 to 90% restoration. But there's one final piece that determines whether you can successfully translate solo function into partnered sexual activity. Step 4. Graduated partner reintroduction. If you have a partner, this is where you involve them. But not the way you think. You're not attempting intercourse. You're doing sensory focus exercises, mutual touch, arousal without the expectation of performance. This eliminates the performance anxiety component while conditioning your body to respond in a partnered context. The protocol. Week 1. Touching only, no expectation of erection. You and your partner explore non-genital touch. This removes performance pressure completely while re-establishing physical intimacy. Week 2. Arousal without intercourse. You allow genital touch and arousal, but intercourse is off the table. This lets you experience arousal with a partner without the anxiety of having to perform. Week 3. Attempt penetration but remove the pressure to complete. If it happens, great. If not, you stop without judgment. Week 4. Full sexual activity without restrictions. Why this phased approach works. By the time you're attempting full intercourse, your tissue is reconditioned, your muscles are strengthened, your hormones are optimized, and you've eliminated the psychological pressure. Your body cooperates because you've systematically removed every obstacle. You're not hoping it works. You've built the foundation that guarantees it works. Men who follow all 4 steps in sequence. 90 to 95% restoration of erectile function within 8 to 12 weeks. That's not a guess. That's clinical observation across hundreds of patients. There's one accelerator technique that most men never hear about, and it's the difference between 80% function and full restoration. This is what I teach in my private practice, and it's why those results tend to be dramatically better. The accelerator is deliberate arousal cycling without completion, and it's counterintuitive. Here's how it works. Twice per week, in addition to your scheduled solo activity, you're going to deliberately arouse yourself to near climax, then stop. Wait 60 seconds while arousal decreases slightly. Resume stimulation, and bring yourself back to near climax. Stop again. Repeat this cycle 3 to 4 times over 20 to 30 minutes, but don't allow yourself to orgasm. You end the session while still aroused. Why would you do this? Because you're training 2 critical systems simultaneously. First, you're maximizing blood flow duration to the erectile tissue. A typical arousal to orgasm cycle lasts 5 to 10 minutes for most men. But when you're cycling arousal over 20 to 30 minutes, you're tripling or quadrupling the time that tissue is engorged with oxygenated blood. That accelerates the elasticity restoration dramatically. Think of it as extended exposure therapy for your tissue. The longer it stays engorged, the more it relearns how to maintain that state. Second, You're building ejaculatory control and arousal tolerance. One of the most common issues men face when resuming sexual activity after a long break is rapid ejaculation. Your body has lost its tolerance for sustained arousal. Your nervous system has been essentially dormant for months, so when it finally experiences high-level stimulation, it overreacts. By deliberately practicing arousal without immediate completion, you're reconditioning your nervous system to tolerate higher levels of stimulation without triggering ejaculation prematurely. You're teaching your body that arousal can be sustained, not immediately resolved. The men who add this technique to the core 4-step method report 2 specific differences. 1. I can control exactly when I finish now. I'm not rushing through sex hoping I can maintain the erection long enough. I know I can sustain it. That confidence transforms the entire sexual experience. You're not performing under time pressure. You're enjoying the experience because you trust your body's capacity. 2. The erections feel fuller. Not just harder, actually fuller, like the entire length is engaged, not just the base. This is the tissue elasticity fully restored. All those corporal chambers we discussed are expanding completely again, not just partially. Here's the biological mechanism. When you repeatedly bring yourself to the edge of climax, your body releases norepinephrine, a neurotransmitter that enhances blood vessel dilation. The more you do this, the more responsive those vessels become. You're essentially sensitizing your vascular system to arousal signals. Your blood vessels learn to dilate more efficiently, which means faster, firmer erections with less stimulation required. But there's a critical mistake men make with this technique. They do it daily. Don't. Your nervous system needs recovery time between these extended arousal sessions. Twice per week maximum, with at least 2 days between sessions. Overdo it, and you'll actually desensitize yourself, which defeats the purpose. Your body adapts through the recovery period, not during the stimulation itself. One patient described the difference this way. Before I added cycling, I'd rate my erections at 7 out of 10, functional but not what they used to be. After 3 weeks of cycling twice per week, I'm consistently at 9 out of 10, and I can last as long as I want. This is the technique that takes men from my function is restored to my function is better than it was 5 years ago. It's the difference between adequate and optimal. I've tracked outcomes for over 400 men who've implemented this complete reconditioning protocol over the past 3 years. Here's what the data shows. At 4 weeks, 73% report return of spontaneous morning erections at least 3 to 4 times per week. At 8 weeks, 82% report ability to achieve and maintain erections firm enough for penetrative sex. At 12 weeks, 89% report erections comparable to or better than their function 2 years prior. But the numbers don't capture what men actually tell me. One man, 64, had gone 18 months without sex after his divorce. He said, "I thought that part of my life was over." Within 6 weeks of starting this, I had my first morning erection in over a year. I actually felt like myself again, not old, not broken, just myself. Another man, 67, dealing with performance anxiety after a single failed attempt. The cycling technique changed everything. I went from being terrified I couldn't perform to knowing with absolute certainty I could. That confidence shift happened before I even attempted sex with my partner again. A 61-year-old who'd been avoiding dating because of erectile concerns. I spent 2 months reconditioning privately. When I finally did meet someone, my body cooperated perfectly. No anxiety, no second-guessing, just normal sexual function. What I hear consistently, "I wish I'd known this 2 years ago," or "I wasted 6 months thinking it was permanent," or the relief of understanding what was happening and knowing there was a specific fix, that alone was worth it. The men who don't see full restoration? It's almost always one of 3 issues. They skipped the pelvic floor work because it seemed unnecessary. They tried to rush into partner sex before completing the reconditioning phase because an opportunity presented itself, or they had underlying cardiovascular issues that required medical intervention first. But for men with no significant health complications, who follow the protocol consistently, the restoration rate is over 90%. This isn't theoretical. This is what I'm seeing in clinical practice, week after week, year after year. So here's what you need to decide right now. You can close this, try to remember the pieces, attempt it on your own, and hope it works. Or you can lock this information in, and make sure you don't miss the critical follow-up. First, subscribe to Vital Health Seniors and turn on notifications. The next content drops in 4 days, and it covers the 3 most common mistakes men make during the reconditioning phase, mistakes that stall progress or reverse gains. If you don't get that information, you might implement everything perfectly for 3 weeks, hit a plateau, and think it's not working when really you just need one small adjustment. Second, like this right now, and I'm not asking for vanity metrics. Here's why this matters. YouTube pushes content based on early engagement. When you like this, it signals to the algorithm that this is valuable, which means it gets recommended to other men who are sitting alone at night, Googling erectile dysfunction, feeling ashamed and hopeless, convinced their sex life is over. You liking this could be the reason that man finds this solution instead of giving up. Third, share this with someone who needs it. Not publicly, I know this is sensitive. But if you have a brother, a close friend, a father who's struggling with this silently, send them the link privately. Text it. Email it. Say this might be helpful. Men don't talk about this openly, which means most men who need this information will never find it unless someone shares it with them. And comment below, just type watched or helpful or your age. That engagement tells YouTube this content is resonating, which pushes it to more men. You could literally help thousands of men get access to this information just by dropping one word in the comments. If you prefer having everything organized in one place you can reference at your own pace, I've linked the complete sexual health blueprint for men over 50 in the description. It's there for men who want structure beyond this conversation. Before you go, there's one more thing you need to know. Everything I've covered, the tissue reconditioning, the muscular strengthening, the hormonal optimization, works. But there's one variable that can accelerate your results by 40% or completely sabotage them. And 90% of men over 60 are getting it wrong without realizing it. It's not testosterone. It's not supplements. It's not medication. It's your sleep architecture. Specifically, how deep sleep and REM cycles directly control nocturnal erectile function, which is the foundation of tissue restoration. If your sleep quality is compromised, you're not getting the 3 to 5 involuntary erections per night that drive the reconditioning process. You could do everything else perfectly and still plateau at 60 to 70% restoration, because your body isn't getting the overnight maintenance it needs. In the next content, I'm breaking down the exact sleep optimization protocol that takes men from plateaued results to complete restoration, including the specific sleep position that increases nocturnal erectile frequency by up to 35%, the one supplement that's clinically proven to enhance REM stage erections, and why the time you go to bed matters more than how many hours you sleep. That drops in 4 days, so make sure you're subscribed with notifications on. Don't miss it. I'm Dr. Mei Anderson. You've spent 17 minutes investing in your health, and that decision is already changing your trajectory. Keep that momentum going. I'll see you in the next one.